Are you considering having jaw surgery to improve your bite and your smile? Or potentially you're halfway through your treatment initially and are due to have your operation in the next few days and weeks? Or you're just somebody who's generally curious about what this whole jaw surgery thing involves, what happens to patients before, during, and after their procedure, and some of the questions that they may have? Well, you've come to the right place. In case you're new here, my name is Amir. Welcome back to my channel, folks. And in this video, I'm going to answer 25 of the commonest questions that I asked on a daily basis to help my patients through their journey for jaw surgery, which then helps them take the plunge or helps them through the whole thing and the recovery afterwards. Questions like, will I buzz if I go through the airport? How much pain can I expect? And crucially, what will I look like once it's all done? What can jaw surgery do for me? Well, jaw surgery or maxillofacial surgery or orthognathic surgery, and I'll come to some of these words in a minute, is potentially a lovely operation which can improve the quality of life for a young person for many decades to come. This is done often on young people who are in their sort of late teens and early 20s. Essentially, it's done to improve the sort of relationship of the teeth and the jaws together, to improve the smile, to improve somebody's bite, and to improve their confidence. So just to give you some examples, here's a young lady who was featured in a newspaper article, and you can see that she has a very strong lower jaw, and in the photograph she's covering her face. Her hairstyle is such that it's covering half her face, and she's kind of putting her hand on her chin to distract attention from what she feels very sort of self-conscious about. And it says here, I always felt I had the wrong face, and she has her jaw broken and then sort of reset in the right place. And the lovely thing is that post-operatively, after the whole thing has been done and dusted and the dust has settled, she looks absolutely much more confident. She's smiling, she's beaming. Her hairstyle is different. In other words, it's pulled back from behind, from in front of her face, and she is smiling much more confidently. You notice in the pre-operative photographs she is not smiling, whereas in the post-operative photographs she is. So this is the kind of thing that jaw surgery can do for somebody. It can do things like, for example, if somebody's lower jaw is very far forward, it can be set back, both to correct a relationship between the teeth and to give somebody a much more harmonious and lovely facial profile. If somebody is very self-conscious, for example, about a very gummy smile, jaw surgery can correct that. Some of this can be corrected with braces, but not all. And in this young lady's case, the whole jaw was kind of pushed further up into her face to correct a very strong gummy smile. It can do things like this. So, for example, it can take somebody from the picture on the left, which is very strong lower jaw, very sort of set back upper jaw, to a much more harmonious facial profile. The photograph in the middle is her in the middle of her treatment, and then at the end is the lovely post-operative result. So jaw surgery can essentially take somebody from the photograph on the left, where the teeth are kind of not quite straight and kind of they don't fit together in a nice way, and there are sort of all sorts of things that are wrong with the angulation of the jaws and so on, to the picture on the right with her looking much more beautiful. What does orthognathic surgery mean? Well, orthognathic surgery is just a big fancy word. It's a bit like orthopedics and orthodontics, and in fact it has a relationship with those two specialties. So the way I think of it is, if you have a family, the meet the orthos, with the dad as the orthopedics and the mum as the orthodontics, orthognathic surgery or jaw surgery, straightening of the jaws, essentially is the sort of offspring of orthopedics and orthodontics. The idea is we break the jaws and set them in the right place, and the orthodontist then does the fine-tuning of the teeth. So at the end, both the jaws and the teeth sit together very nicely. What problems does jaw surgery actually solve? Well, a variety of problems can be solved using jaw surgery. Things like, for example, if somebody has a gap between their upper and lower front teeth, for example, they used to suck their thumbs when they were a child and they can't bite into a sandwich. Quite often it's because just people are a bit reluctant to smile, either because their teeth are not straight and crooked, but also the relationship between the jaws is not quite harmonious. So for example, they have a very strong lower jaw, which is way far forward, and there's a gap sort of between their upper and lower teeth, not in the sort of vertical dimension, but in the horizontal dimension, something called a negative overjet. I'm not going to use technical jargon in this video, so you can rest assured about that. But essentially, it can make somebody's face and their bite look much more quote-unquote normal and harmonious, which is a really lovely thing to achieve. Do I need jaw surgery, or will braces alone do? Well, of course, there are some issues that can be resolved with braces alone, and there are many hundreds of thousands of young people who have braces alone, essentially just to sort of straighten teeth or close gaps between their teeth, and that's absolutely fine. Essentially, the orthodontist seeks the help of a surgeon when the discrepancy or the sort of bite relationship problem is kind of too severe for that to be done with braces alone. So the answer to the question is yes, quite often braces alone will do, but in some select cases, and usually selected by an orthodontist or a surgeon, where the problem is kind of much more severe, then that is done with a combination of braces and surgery. How do you know which jaws to move? Well, this is done in combination with the surgeon and the orthodontist. It depends on obviously the discrepancy. So for example, if somebody's lower jaw is too far forward, that can be a result of the lower jaw itself being too prominent, the upper jaw being too set back or too small, or a combination of the both, which then dictates what kind of surgery the patient requires. So the commonest jaw surgical procedures that are done are bringing the upper jaw forward or slightly upwards, and bringing the lower jaw forwards or backwards, or correcting what we call asymmetry, so to correct the sort of sideways direction of the lower jaw or upper jaw. And all of these can be done in combination, which is what makes it interesting and, much more importantly, bespoke to the individual patient, because not everybody is the same. Everybody's different, and everybody's needs are different, and everybody's expectations are, of course, different. And so the answer to the question is, how do you know which jaws to move? The answer to that depends on where the discrepancy lies, how severe it is, and what can be done with a minimum of surgery, potentially, ideally, and then to give the patient a lovely harmonious facial profile, a bite, and a lovely smile. What is my typical treatment course? Well, of course, you may already be halfway through the treatment, so the initial pre-surgical treatment phase. But for somebody who's considering it potentially and is kind of curious about it, wondering what the whole thing involves, the process, the sort of the funnel which then leads to surgery, essentially starts in a variety of ways. Some people go to their primary care physician, or their GP, as it's known in the UK. They go to their dentist. They go directly to either an orthodontist or a maxillofacial surgeon with something that they perceive as a problem, or an issue with their bite, an issue with their smile. Their teeth don't quite fit. There are gaps here and there. They're self-conscious about smiling. They have problems with their bite and chewing, and for a variety of reasons. Quite often then they are met and then assessed by an orthodontist. And usually this orthodontist, this braces specialist, has done some further training or exams or what have you, and they are much more of a sort of specialist in jaw surgery, which then allows them to sort of opine on whether the patient potentially can be treated with braces alone, or they may need to have a surgical procedure. If that is what the orthodontist assesses that the patient needs, they are brought to something called a joint clinic, as it's known. And this is where a surgeon and orthodontist meet on a regular basis, and they discuss patients with the patient, having taken some molds of their teeth, for example, some x-rays and some clinical photographs, sort of proper, with a nice DSLR camera rather than with their phone. And then all of these information is fed into some sort of process where the surgeon and the orthodontist agree with the patient that essentially there is a problem here, that we can do something about it, that the patient's expectations are realistic, and that everybody feels that this would be a worthwhile process to go through. And then if that is the case, then there's another funnel, then patients are sort of channeled into the sort of treatment phase. There's usually a sort of, a year to 18 months of what we call pre-surgical orthodontics, where the orthodontist essentially prepares the jaws for surgery, does some of the fine tuning initially, potentially involving some extractions of wisdom teeth and other teeth to make some room, for example. There's a variety of things that the surgical orthodontics involves. And then after about a year, 18 months, then they come back to somebody like me, who then does their surgery for them, which is the sort of the turnaround point in the whole process. After that, there's a period of 3 to 6 months of something known as post-surgical orthodontics, essentially tweaking and fine-tuning of the bite and the teeth while the dust settles and everything kind of goes back to normal. And then there's a lovely thing at the end where the patient comes back and has what we call a debond, in other words, where all the braces come off and the patient smiles and it goes underway. And this is a lovely thing because most of the time when we see patients at this stage, quite often they are absolutely delighted with the result. And as I showed you earlier in that example from the newspaper, the look is different, the energy is different, the vibe is different. The young person usually smiles a lot more, is much more confident, and variety of other things like hairstyle is different and all sorts of things. So it's really lovely to see that. But that's a typical patient journey from the very beginning to the very end, typically in the UK anyway. How do you assess my face? Well, again, this is done in a sort of professional joint clinic in a setting where the surgeon and the orthodontist meet you and sort of assess you. Sometimes they kind of gawk at you in a very awkward way, but essentially just assess whether the soft tissues of your face and your lips and your mouth and then the jaws and the teeth are kind of where they are and how do they fit in relation to each other. We are assisted in in this assessment by things like X-rays, molds of your teeth, and clinical photographs. And so all of this is fed into the process, and in some cases where you have fancy scans where the planning is done by a computer, and I'm sure in the future this will all be done by AI. But essentially, we have a very good look at you. We look inside your mouth, we check your bite and your facial proportions and so on. And this is all done in collaboration so that the proposed treatment plan is bespoke for you and actually fulfills all your expectations. What does the orthodontist do? Well, I alluded to this a little bit earlier. Orthodontists are a core part of the surgical planning process, and essentially what they do is prepare the teeth with finer movements prior to surgery. The surgeon does the sort of bigger movements, and then they fine-tune and sort of tweak the process afterwards to make sure everything is nice and settled and harmonious. And the orthodontists are often the people who spend the most time with the patients. I mean, as a surgeon, I usually see them once or twice at the beginning, once or twice before the operation, very intense involvement around the time of the operation, and then maybe once at the end when the whole thing is just kind of borne fruit and the lovely result is visible. So orthodontists are an absolutely crucial part of this process, and they will be able to answer a lot of these questions as well, but I'm just answering them from a surgeon's point of view, which is when the whole thing becomes a lot more intense and people have a lot more sort of immediate questions. How do you move my jaws? Well, this is all done when you're asleep, so and this is a controlled fracture, controlled break of the jaws. In fact, as a little sort of interesting anecdote, the first time this was done was in the early 1950s by an Austrian surgeon, somebody called Professor Obwegeser, who I had the privilege of meeting once. And this was done on a sort of relatively young woman, so in her late 20s, under a local anesthetic. In other words, the patient wasn't knocked out in an operating theatre. It was in a sort of dental chair setting. This poor patient had local anesthetic like you would have for a dental procedure or an extraction from ear to ear, and then they kind of broke her jaw and then put her into wires and then said, see you in a few weeks. So I can imagine what the poor patient went through. Nowadays that is not done. The whole process is much more professionally done. And the answer to the question is we move the jaws by a process of a controlled break of the jaws. We break the jaws in effect and reset them. And that's basically, so for example, if somebody has a very prominent lower jaw, we break the lower jaw and set it back. And essentially that's what it is. And then, of course, the fracture is fixed in a variety of ways, most commonly with plates and screws, essentially to keep it there while it heals, in the same way that if you have a broken leg, the surgeon puts the bones in the right place and finds a way via a variety of means, plates and screws, nails, casts, what have you, to keep them in the right place while it heals. What can I do before my operation? Well, there's a lot of things you can do to sort of make the whole process much more smooth and safe in many ways. So, for example, for my young lady patients, I always encourage them to stop the oral contraceptive pill a good 6 months before the operation. And the reason for that is because it has the potential to increase the risk of clots in your legs, clots in your veins, and so on. If it is possible, you should lose a little bit of weight. People who smoke or even nowadays vape are usually not plugged into the whole process. Personally, I have a very sort of strong opinion about people who smoke when it comes to this sort of thing. Remember, this is an elective operation. Elective means you don't have to have it done. You know about it weeks and months in advance. It's not an emergency operation. And so you have plenty of time to think about these things. And usually if somebody is a smoker or a vapor, we basically sort of wave goodbye at the very beginning of the stages so that we don't waste anybody's time. We don't want to waste anybody's time. We don't want to waste valuable taxpayers' money in the UK or, sort of other resources if you're elsewhere in the world. And so losing a bit of weight is a good thing. Absolutely meticulous oral hygiene. So if your oral hygiene is not up to scratch, we encourage you to improve that. And as I said, you'll have months to do that. So there's plenty of time to achieve all of these aims. But yeah, so stopping the contraceptive pill, losing a bit of weight, and above all, patient education. Improve your education about this whole process, which is what this video is kind of partly about, and to find out how best to make sure that you have a very smooth journey through the operation and come out to it the other end with fewer problems. Another thing you could do is to tell your family and friends, your work, your school, university, make sure you have plenty of support in place. How long do I need to take off work, school, etc.? I get this question a lot. It depends on what you do. So for example, somebody who is a member of what we call the laptop class, or if you're a student and you don't do any manual work, then potentially a month is more than enough. So 2 weeks for the initial sort of dust to settle, and then a couple of weeks for the sort of any problems that might arise. So we usually say about 2 weeks to 4 weeks for somebody whose work doesn't involve any physical activity. If you do manual work, we usually say a little bit longer, perhaps 6 to 8 weeks, but it all depends on how long what you do to how long you take off. And of course, as I said earlier, this is an elective procedure. It's, you know about it weeks and months in advance, so you have plenty of time to put arrangements in place. So for example, if you have children, to make sure that you have childcare in place and things like that. Are you going to wire my mouth shut? The answer to that is no. As I was alluding to earlier, the first time this was done in the 1950s, that's how they used to, quote unquote, fix the jaws. But now we don't do that. We use plates and screws, which are inside, tucked away, invisible and impalpable. And so, no, we don't need to wire people's teeth together. In fact, the reverse is true. I always encourage my patients to go back on something resembling a normal diet as soon as possible, in the same way that, for example, if somebody has had a fractured hip, they are encouraged to get back on their feet or sit in a chair initially and do some non-weight bearing and then weight bearing, and then sort of get back to essentially normal as soon as possible in the form of sort of self-physiotherapy. So we do not wire people's teeth together these days, and we encourage people to get back to quote-unquote normal for them as soon as possible. How long does the operation take? Again, it varies, but just to give you a rough idea, a single jaw operation takes about 2 hours. That's sort of operating time, give or take with all the anesthetic time and all the other sort of things that go with it. And a two jaw operation, upper and lower jaw operation, if you're having that, that takes about 4 hours of operating time. That, of course, doesn't mean that you're going to sort of be back on the ward immediately at 4 hours or at 2 hours. It takes a while for you to recover and so on. So I always encourage my patients to sort of overextend that a bit. If they want to, for example, tell their family and friends to come and visit them in the hospital, to give it a while until they're sort of more fully awake so that they can be a bit more themselves. But the actual operating time, the bit that I do when the patient is asleep, when we're actually operating, so an hour and a half to 2 hours for a single jaw, 3.5 to 4 hours for a double jaw, that sort of ballpark. How much pain should I expect? Well, this is a question I get all the time, and people sort of overestimate this a little bit because obviously, as you can imagine, this is a controlled break of the jaws, or one jaw, depending on what you're having. And unlike the other kind of jaw fracture, which involves, a punch up or a violent event, you're not going to know any of this, so you're not going to feel any of the pain. You'll be fast asleep. And in fact, when you're fast asleep, the anesthetist or the anesthesiologist will give you plenty of very strong painkillers so that you don't actually perceive any of the pain when you wake up. Of course, there's a degree of discomfort when patients wake up, and then they kind of that kind of settles with time, usually within a few days. So I wouldn't never describe it as sort of pain because we have a lot of ways of controlling that, but you can actually expect a degree of discomfort. And actually the degree of discomfort that you perceive after the event, after you wake up, has a lot to do with how much you expect, as a sort of self-fulfilling prophecy. If you're expecting doom and gloom and sort of, then you can experience a bit more pain. But quite often, it's actually surprising that most of my patients, in the many years I've been doing this, don't actually complain of pain as the main problem as far as they're concerned. I'll come to some of the other issues in a moment, but pain, paradoxically, is not a major complication of this kind of surgery as far as the patients are concerned. What can I expect after my operation? Well, this is a very good question because when you wake up, everything is going to be very strange. You're going to wake up in a recovery room with nurses and lots of tubes and things like that. And so obviously it can be a bit disconcerting initially. But what you can expect is when you wake up, you're going to be completely numb, usually partly because of the actual operation, but also because of the anesthetic that you've had. If you've had one single operation, obviously your lower jaw or your upper jaw, or if you've had both, then both of them will be numb. You essentially will be numb from your sort of eyelids down to your chin. Most of that usually resolves within a few hours, potentially days. The other thing you can expect when you wake up, obviously everything, depending on how severe your discrepancy was preoperatively, everything will feel a bit strange because your jaws and your teeth and your cheeks and your tongue and your lips and so on, they've had, you've grown up and you're used to them being in a certain position, and now they have changed. So everything kind of feels a bit odd and strange. It can be a bit difficult to, for example, find your bite initially, to feel your bite. But all of this kind of comes back to normal fairly soon. Most of the numbness usually wears off within a few hours. One of the things that can, of course, happen, and I'll come to this shortly, it can actually be a little bit longer. The numbness can be protracted and can last a little bit longer. The other thing that can happen when you wake up, you can be a bit sort of sore, obviously, a bit sort of in mild discomfort, because you will have been given a large number of painkillers and very strong painkillers that you can't get anywhere else. So pain is not a major issue, but you can expect a bit of discomfort. You might be a little bit nauseous because sometimes patients swallow a little bit of blood because obviously it's in the mouth and it's connected to your food pipe, and the other end of your food pipe is your stomach. We usually it's not very nice, but we pump out some of the contents of your stomach before you wake up, but it can be a little bit left, which can, obviously, your body doesn't like that. It may want to expel that. You may feel a bit nauseous and potentially vomit sometimes. again, we have ways of mitigating this, either with removing the contents initially or with some medication. The other thing you can expect, obviously, is you might be a little bit dehydrated, and we encourage you to, we'll give you some fluids and so on. And I always encourage my patients to start sort of some sort of normal diet as soon as possible. You might have an ice lolly or an ice cream or something initially, maybe some soup, something, and then just change the taste in your mouth, and then eventually get back to a relatively normal diet. So that's what you can expect immediately after you wake up from your operation. What are the complications of my jaw surgery? Well, there are quite a few. Most of them are fairly mild and infrequent and not particularly a major deal. The one that we always quote that can be a potential long-term problem that can last is numbness of the lower lip if you're having a lower jaw operation. The numbness of the upper lip and the cheeks is much less likely, but the numbness of the lower lip is something that can happen. It does happen something like 1 to 2%, 1 to 3%, something of that order, to give you a ballpark figure. The other complications can be a fair degree of swelling, which sets in usually around 48 hours. That's when it reaches the peak, and most of it will be gone by 36 to 48 hours. So fair bit of swelling. Again, there are ways you can mitigate that. You can, for example, use a bag of frozen peas or something cold around your face, around your cheeks, to reduce the swelling. That swelling then turns to a bit of bruising, which then sort of works its way out over a few days. Generally, this is a very safe, very predictable operation, quite often done on young, fit, healthy patients with no pre-existing problems and conditions. It's done in a very, very sort of predictable way. We have very good results. And the one complication that we go on about, which is something that could potentially be serious, is numbness of the lower lip. As I said earlier, the chances of that happening are something like 3%, 2 to 3% of that order. And it's important to remember that this is a sensation nerve. It's not a movement nerve. So people looking at you wouldn't see anything different. You would feel a degree of numbness, which then eases with time. It might just turn to a bit of tingliness over a period of time, if it was to happen, of course, in the first place. But generally, the complications of this operation are fairly mild, fairly infrequent, fairly rare. And if they were to happen, they're fairly manageable in many ways. Will my jaws stay where you put them? The answer to that is yes, by and large, because they will be fixed in place with plates and screws. Sometimes there is a thing called relapse, where there is very, very fine, barely perceptible movement of the teeth, of the jaws, back to the position where they were before. This is obviously something that's unfavorable. You try very hard to avoid that through a variety of means which are outside the scope of this talk, but there is a potential risk of something called relapse, which will be very, very mild and very, very subtle, very, very long term. And this is the reason why the orthodontist afterwards often puts you in something called retention, either with sort of mouth guards that you fit over your mouth, or something that's sort of glued, a piece of wire that's glued to the inside of the lower front teeth, whatever the case may be. But essentially the purpose of retention is to make sure that the jaws and the teeth stay where you've put them. So yes, the answer is, will my jaws stay where you put them? The answer is, by and large, yes. What can I eat and not eat? This is a very good question, and one that I get often. So in the immediate aftermath of the operation, because everything is kind of a bit swollen and your teeth may not necessarily kind of be where you expect, your brain expects them to be, it can be a bit weird and awkward for you to eat. And so we always recommend something very soft. It doesn't have to be liquid. I always recommend something that you can mash up with a fork, something like scrambled eggs or mash, or very soft pasta, something like that. You can eat that immediately afterwards. After so day 1 or 2. The sort of broad outlines of the dietary advice is anything you can mash up with a fork for about 2 weeks, while the dust is settling, while the stitches are melting away, while the swelling is going away. Then for another 2 weeks, so 2 weeks to 4 weeks, a little bit sort of something like pasta, rice, risotto, softish diet. Uh, 4 to 6 weeks, kind of a normal diet, like chicken and curries and, various other things like that. And then after about 6 to 8 weeks and onwards, then crunchy, chewy things like baguettes and crisps and steaks and things like that. So usually very, very soft diet initially for about 2 weeks. Up to 4 weeks, anything you can mash up with a fork is okay. Then build up to a sandwich and rice and that sort of thing, pasta. And then 6 to 8 weeks onwards, back to essentially a normal diet. And it's very important that you do that, because otherwise, if you just constantly have a liquid diet, then your teeth and your bite are not going to have the sort of physiotherapy essentially required to find their new home, and for your brain and the soft tissues of your face to get used to the new position of your jaws and your teeth. So that's what we recommend in terms of your diet. Can I brush my teeth afterwards? The answer is you must brush your teeth afterwards. In fact, oral hygiene is one of the things that is absolutely crucial in the immediate aftermath of this operation. Of course, you must be very gentle, and sometimes some people buy a children's toothbrush or run their own toothbrush under a hot tap to sort of soften the bristles initially. Don't forget, you will also have some stitches inside your mouth, stitches that melt away over a period of, say, 2 to 3 weeks. So obviously it would be silly to brush those with your toothbrush. You mustn't do that. The way to keep the stitches clean is to use a bit of warm water and a bit of salt, so warm salty mouth rinses to keep the stitches clean. But the answer is you must absolutely brush your teeth and your braces afterwards, because one of the reasons why there could be a potential infection, and which is a complication that we really don't want and we are very keen to avoid, is not paying enough attention to your oral hygiene. Your oral hygiene on the day of your operation has to be absolutely perfect, and for the next few weeks after your operation needs to be very, very good to avoid any problems. Will I have any scars on my face? The answer to that is a no. There are some surgeons in the UK who sometimes put a little screw through the cheek and they make a tiny little incision, tiny little cut, which for a few days and weeks it looks like a mosquito bite and then fades away with time. But I don't even do that. Everything I do is done from the inside of the mouth. So patients will not know you've had an operation at all. Everything is done from the inside. All the cuts are on the sort of gums and the soft tissues of your mouth. So the answer to the question is very briefly, no, you won't have any scars on your face. Will I buzz when I go through the airport? I get this question all the time, and the answer to that is a no. Of course, there are thousands of people who go through the airport every day with metal bits and pieces in their bodies, like hips and knees replacements and various other things. And so they don't buzz when they go through the airport. I think the machines are calibrated to take account of that. The jaw plates and screws that hold your jaw in the position, they are incredibly small. They are thinner than a coin. They're made of something called titanium, which is a very strong metal, very inert metal. Inert means it doesn't react with your body at all. It just stays there for the rest of your life, and very occasionally they get removed in case, for example, somebody has an infection and things like that. But essentially, no, you won't buzz as you go through the airport. And so quite often, actually, you just forget about them. They stay in your body. They're tucked away, and they barely cause any problems at all. Can I play contact sports? The answer to that is, of course, yes, but obviously not initially. It takes about 6 to 8 weeks for the bones and the sort of the wounds and everything to heal. It takes about 3 months for the bones to really heal, so that you can play rugby, for example, or boxing and things like that. And so we usually recommend patients. I usually tell my patients not to play contact sports for 6 to 8 weeks, couple of months. If it's something that involves direct trauma to the face, then 3 months. So, for example, if you go up for a header when you're playing football, and by football I mean British sense of football, soccer, not the one with shoulder pads and helmets in America, then yes. So obviously 6 to 8 weeks, 3 months for something that is very directly involved, like boxing and things like that, or martial arts. And so The answer is yes, of course. You can get back to your normal life as soon as the dust has settled. Will my plates and screws stay in my face forever? Well, I've kind of alluded to this already a little bit. The answer to that is yes, in the vast majority of cases. In some countries, they take the patients back to the operating theatre, to the operating room, to remove the plates and screws. I've never understood why that is. Well, actually, I do understand it. This may have something to do with finances, but we don't do that in the UK. We essentially just wave goodbye to the patients. Sometimes the patients come back and see me for removal of a plate, either what we call electively, in other words, there may be a boxer or something like that. So sometimes when there's absolutely no sort of medical reason to remove it, but more often than not, sometimes, as I said, this is less than 5%, but sometimes the patients have an infection, or they've had some minor trauma to their face, and sort of the plate has slightly moved, or sometimes they have quite literally a screw loose, and which happens, and so we can actually take the plates and screws out. We try and avoid that, obviously, because it does involve potentially another procedure, potentially another general anesthetic. We try and avoid all of this if at all possible. But generally, by and large, will my plates and screws stay in my face forever? Yes, is the answer, and they don't cause any bother at all. Last but not least, what will I look like afterwards? Well, I mean, this is something that everybody wonders about when they're embarking on this journey. What will I look like afterwards? Will it have been worth it by the very end? And what will you look like afterwards? That depends obviously on the sort of the size and the direction of the moves and your initial discrepancy and initial issue that needed correction. But in the vast majority of my patients' cases, they're absolutely delighted with the final outcome. I showed you this lovely young lady whose permission I have to share these photographs, who went from this with a very sort of abnormal bite and smile to a lovely result afterwards. Most of our patients are pleasantly surprised on the upside, both in terms of how sort of relatively less pain and discomfort they felt compared to what they expected, and also the final outcome. So like I was saying earlier, this is one of the loveliest parts of my job with this kind of surgery. Patients are young and fit and healthy. They do well. They have a good result. And unlike, for example, sort of other kinds of surgery where you do it on elderly people to gain some comfort and relieve pain and potentially improve and prolong their lives for a few years, if you do an operation that has a meaningful impact on some person's life, this carries on and cascades down potentially decades, as is the case with a patient who's in their late teens or early 20s. And so the results of these operations are potentially life-changing, and most of my patients anyway, are pleasantly surprised on the upside. So I hope this video has been of some use and of some interest. If you have any further questions, please by all means put them down in the description below, and I'll be happy to answer any further questions you may have. Thank you very much for watching to the very end, and I'll see you on the next one.